Although we don't always think of our skin as an organ in our body, it is actually the biggest one we have. It protects us from dirt and bacteria, and so it is important for us to protect it with exercise, a well-balanced diet, and plenty of fluids. It is important to check our skin daily for any pink or red areas that don't go away, or red areas that feel hard to the touch. Be sure to look over all bony areas that you can see on the skin, in skin folds, and places where a splint or a brace has been worn. Feet should also be checked daily as well. If you notice these pink or red areas, contact your healthcare provider. These reddish areas on the skin could mean the formation of a pressure ulcer, sometimes called a bed sore. Pressure ulcers can develop if you stay in any one position for a long period of time, and they can begin forming in as little as 2 hours. With unrelieved pressure, the blood flow to the area slows down or stops, causing the skin to die, which causes the pressure ulcer. If your skin is lighter, a red spot that won't go away even when you change body positions could be the beginning of a pressure ulcer. If your skin is darker, the spot may have a blue tone, or the area may feel a little hard or warm and painful when touched. When inspecting your skin, it is important to look carefully since pressure ulcers can form in hard-to-see areas such as the inside of the legs or where the knees touch in a side-lying position. Carefully check the area where the buttocks come together over the tailbone because this is the #1 area for pressure ulcer development in a bedridden patient. Any damage to the skin, such as scrapes, blisters, cuts and bruises that do not appear to be healing can be a serious problem and may require medical treatment. Reacting quickly by contacting your doctor or nurse practitioner is important. Pressure ulcers happen when there is a constant pressure in an area of the skin, usually over pointy, bony areas like your tailbone, heel, or hip. But they can also form on the knees, ankles, shoulder blades, back of the head, skin folds, and spine. The skin becomes squeezed between the bony area and an object like a mattress or a chair. It is important to know the risk factors for pressure ulcers. If you are confined to your bed or spend a great deal of time in a chair or a wheelchair, you are at a higher risk of getting a pressure ulcer. If you can't change your position without help, you are also at greater risk. Your caregiver should help you reposition yourself frequently to prevent the formation of pressure ulcers. If you can move around on your own, walk or do exercises in the bed or chair to help with blood flow. Try to change positions at least every 2 hours. Keep ankles and knees from touching one another. While you are sitting, change positions every hour and try to shift your weight every 15 minutes if possible. Good nutrition is also important for healthy skin. Without a balanced diet, wounds may not easily heal. A healthcare professional should be called with any signs of weight loss, poor appetite, too little food and fluids, severe diarrhea, and general weakness. Foods rich in protein, vitamins A, C, and E, zinc, and iron all promote wound healing. Eating small meals more often or adding healthy snacks can help. Dehydration means your body does not have as much water and fluids as it should. Vomiting and diarrhea are common causes. Urine may turn dark in color and have a strong odor. Dehydration slows down the body's healing process and may be life-threatening. Consult a medical professional if you suspect dehydration. To help avoid dehydration, try small sips of liquid throughout the day. If you have trouble controlling your bladder or bowel movements, you are also at risk for pressure ulcers. Urine and bacteria in stool weakens the skin and can cause infection in a pressure ulcer located in that area, making it hard to heal. Make sure the skin is always kept clean and free from urine and stool. Use mild cleansers to gently wipe the skin, and if wearing diapers, apply protective ointment such as Vaseline to the area after cleansing. Always wash hands well both before and after any cleansing. Finally, pay close attention to your feet and heels. The heel is at high risk for pressure ulcers, especially when a person spends most of their time in bed. The skin and padding over the heel bone is thin and can press against the bed, causing sores. If you have a history of poor blood flow to the feet or toes, you are at even higher risk for pressure ulcers or serious infections. To lower your risk, don't expose your feet to hot or cold temperatures. Wash and pat your feet dry thoroughly, but don't rub or soak your feet. Always wear well-fitting shoes and check inside them for objects like a small pebble that could injure feet, especially if you are a diabetic. Remember, any change in how the skin looks or changes in color over bony areas like your tailbone, heel, hip, or ankles could be the beginning of a pressure ulcer. It is very important that a healthcare professional be called whenever a pressure ulcer exists or when one is suspected. Thank you for watching.